my name is Tiffany and I'm going to be your nurse today. Can you tell me your name?
Brayden.
Okay, Brayden, and how old are you?
7.
7, and when's your birthday?
June 4.
Okay, good. So you're in today for a head, eyes, nose, mouth, ears, and throat exam, okay? Is it okay? Okay, and we're going to start at the top of your head, so I'm just going to feel the shape of your cranium, and we're going to feel for any lumps, bumps, or bruises. Does it hurt whenever I touch anywhere?
No.
No. Okay, good. So now we're going to look at your scalp. You're going to look for any redness, scratches, draining, infestations, anything like that. I don't see anything. You have nice, thick, dark brown hair that's equally distributed throughout. So everything looks good up there. We're going to move down to your face. We're going to first check for symmetry. We're looking at your eyes, nose, mouth, and ears to make sure that they're sitting and they're equal on each side. Your ears are at the appropriate height on your face. Your nose is centered. Your mouth is centered. Everything looks good. We're going to feel your temporal arteries. Okay, good. I'm going to feel your maxillary sinuses. Any pain here whenever I touch?
No.
And your frontal sinuses. Any pain here?
No.
Okay, good. And now we're going to check cranial nerve number 5, which is your trigeminal. So can you open your mouth, close your mouth, and bite down hard? Good. And now we're going to do cranial nerve number 7, which is your facial nerve. So can you smile, frown, and blow out your cheeks? Okay, good. Everything looks good there. So we're going to move on to your eyes. We're going to start with the external structures. So we're just going to look at your eyebrows, your eyelids, your eyelashes. We're looking for any redness, swelling, drainage, or anything like that. It all looks good. So I'm going to pull down. You can look up, and I'm going to look at your sclera, which is white. Your conjunctiva is nice and pink and moist as it should be. So you can turn to the right. We're going to check the shape of your eyeball. Make sure that it's round. Good. Other side. Looking for a round shape. Good. So now we're going to do cranial nerves number 3, 4, and 6, which is your ocular motor, your trochlear, and your abducens. So I want you to hold your head still, look at the tip of my pen, and follow it with your eyes only, okay? Perfect. Okay, now we're going to check your pupils for a reaction. So I want you to look straight ahead at the dot on the wall. Good. Other side. Good. Now I want you to look at my pen. Now I want you to look at the wall. Perfect. Our pupils are equal and reactive to light and accommodation. Okay, so now we're going to move down to your nose. We're going to make sure that it's centered, which it is. We're looking for any redness, bumps, bruises, swelling, drainage. So I don't see any of that. So you can lift your head up, and I'm going to look up your nose, making sure that your nasal mucosa is moist and pink, and it is. Your septum is right midline as it should be. So while we're here, we're going to do cranial nerve number 1, which is your olfactory. So close your eyes and tell me what you smell, okay?
I smell peanut butter.
Good. And now we're going to do cranial nerve number 2, which is your optic nerve. So I want you to read this to me.
Peanut butter.
Very good. Everything looks good there. So we're going to move down to your mouth. We're going to look at the external structure of your lips. We're looking for dryness or drainage, cracks, which they're a little dry from the cold weather. So you can open slightly. Open your mouth. And we're going to look at your gums down here to make sure that they're nice and pink, no redness. And now open a little more. A little more. So we're going to look at your teeth and see that you've lost your 2 front teeth. We're going to look at your buccal mucosa, your hard palate in the front here, your soft palate, your tongue. Can you stick your tongue out? And we're going to look at your uvula. Okay, good. So while we're here, we're going to do cranial nerve number 9, which is your glossopharyngeal. So can you swallow for me? Okay, good. Now we're going to do cranial nerve number 10, which is your vagus nerve. So can you open and say, ah, really loud?
Ah.
Perfect. Everything looks good there. So now we're going to move to your ears, and we're going to just check the external structures to start with. Looking for any redness or draining. Looks good over here. Everything looks good over here. So now I'm going to feel, and you tell me if you feel any pain or tenderness. Does it hurt right here?
No.
How about right here?
No.
Okay, good. So now we're going to do cranial nerve number 8, which is your acoustic nerve. So you're going to close one ear, and I'm going to whisper something to you, and I want you to tell me what I said.
Cheeseburger.
Okay, other side.
Taco soup.
Taco soup. Okay, very good. So everything looks good there, and now we're going to move down to your neck. So we're going to look first for any pulsations or lesions or bruises. So everything looks good. Trachea is midline, as it should be. Okay, and now we're going to do cranial nerve number 11. So what I want you to do is I want you to shrug your shoulders up while I push down. Okay, good. And I want you to try to turn your head against my hand as I push against it. Okay, other side, just a little. Okay, and cranial nerve 11 is your spinal accessory nerve. Also, we're going to do cranial nerve number 12, which is your hypoglossal. So can you stick your tongue out? Can you go side to side with your tongue? And can you say light, tight, and dynamite?
Light, tight, and dynamite.
Okay, good. So next I'm going to feel all of your lymph nodes, and I'm going to call out the name of them as I touch them. If you feel any pain, just let me know. So we have your pre-auricular, posterior auricular, occipital, submandibular, submental, posterior cervical on the back, and then we have your superficial cervical, and then you're going to turn your head this way, and I'm going to do your deep cervical chain right here, and then the other way, and then we're going to do your deep cervical chain right here, and then shrug your shoulders just a little bit, and we're going to do your supraclavicular. Okay, good. Any pain in any of those? So the next thing that we're going to do is I'm going to have you take a small sip of water and hold it in your mouth. And you're going to turn slightly so I can feel you from the back. And you're going to hold it there until I say swallow, okay? That's probably enough. Okay, is it in your mouth? Okay, so what I'm doing now is I'm going to palpate your thyroid gland and swallow. Did you swallow it all? You can swallow it all. Okay, good. Do you have any questions, Brandon? And that concludes my assessment.